Welcome back to San Antonio Living. About 25 million people in America have asthma, and those numbers are increasing every year. Alana spoke to a local expert to learn a little bit more to find out if you are one of them.
Asthma is a disease that affects many Americans, especially kids, and the scary part about it is you may or may not know that you have it or not and how to control it. But here to tell us more, we're talking to Dr. Patel of Texas Medical and sleep specialist. Thanks for being here.
Hi, nice to meet you.
Actually, thanks for having me here.
For sure.
Well, tell us a little bit about the clinic. It seems very home and cozy.
Yes, so once the patients check in, we try to instill a warm environment for the kids when they come in. As you can see as we walk over here, part of our testing process is to do lung function testing. Lung function testing helps us determine their total lung capacity, allows us to manage their asthma, and also to help diagnose asthma.
You know what? I had asthma, and I was convinced that I grew out of it, but I think you're going to tell me otherwise, that I did not grow out of it. I think I just learned how to control it a little more.
Yes. So let's come over here and I'll show you our clinic. This is a room in which the patients come in with their family. We provide toys here so that they keep them occupied. And we also have some diagrams up here and some pictures to further illustrate on the disease process of asthma.
I really enjoy how kid-friendly this is. And of course, This is all about the kiddos today because your child at home may have asthma and you don't know it yet. So I think it's important to discuss that. Are you ready to talk a little more about asthma?
Yes.
Let's go.
So asthma is a condition in which you're genetically predisposed, and then your environment will influence how your asthma behaves and acts, and it varies over your life on how it behaves. Many people will have early childhood asthma, and as they become adult, they claim they outgrow it. Well, technically, you don't really outgrow asthma, but it's a disease that is primarily, what I was mentioning earlier, affected by the environment. It's involving both large and small airways. So when you look at the lungs, the really small parts of the airways are also impacted, and it's a disease primarily of inflammation. 25 million Americans are affected with asthma in the U.S., and about 7 million of them are children. It's a very large reason for missed school days, and if your child is well controlled and is on proper asthma therapy, they are like every other child and able to play all the sports they want to. However, if they're not being adequately treated, those are the kids that tend to have a chronic cough, they have to miss a lot of school, they get disrupted sleep because they're coughing all night.
So now we have a parent who you have caught their attention. You know, my kid's been coughing a lot, they've been wheezing a little bit. What are the next steps they should do? They've
been coughing a lot and they've been wheezing. They need to go see their healthcare provider. And it'd be very, very important to ask them if this is asthma or is this something similar to asthma. A place to look for is on the website, getsmartaboutasthma.com. And there you can find all this information about disease process affecting the large and small airways, some of the symptoms, as I mentioned, about the recurrent chronic cough. If you're going to the doctor frequently for cough and being diagnosed with bronchitis, or needing to use breathing treatments or rescue inhalers frequently. Those are all telltale signs of asthma. GetSmartAboutAsthma.com will give you a lot of the added information you need, so when you do go see your healthcare provider, you can ask them the appropriate questions. And once you've had asthma and you were on therapy, many people tend to stop their medications because the medicines work so well that you feel so great that you think you're cured. Well, sure enough, when school starts, when these kids are off their medications, they will catch their first cold, or if they have any sort of allergic predisposition to like mountain cedar, ragweed, and mold, all those things on top of catching a cold will set their asthma off. One last thing I would say to parents is that educate yourself, ask your provider about asthma. A great website I mentioned earlier, GetSmartAboutAsthma.com would be a great place to look to get informed.
So if you would like more information, contact the Texas Medical and Sleep Specialists. There are 4 San Antonio locations. All the information is there on your screen. You can try the website, txmss.com, or call and ask for a consultation, 249-5020. Again, 249-5020. And the website that we talked about in that story, getsmartaboutasthma.com. We'll be right back.